Saint Theresa.
Wonderful.
Saint Theresa.
Wonderful.
Saint
Wonderful.
Teresa.
Service to God and mankind.
I'm sure good evening.
Good evening.
I'm sure time here you best share health talk na say. Before I best start me per se that the organizers na say which is Dr. Azira and Opini so some were putting together this wonderful program for your members see. And see Dr. Azira and Opini so I na say. This and their health talk is about women's screening and menopause. Inti me December no mefre Dr. Azira now was starting. Dr. Azira will be talking about women's screening, mammogram, pap smear, and colonoscopy. Inti Dr. Azira patrol will line so with me I show I start.
All right. No, good evening. See, me wage monty. Me make a note, simple and short, and then we are not time or not be for questions. All right. And see, just like Mrs. Rose Kayano, and then I'll touch on 3 topics. We'll talk about colonoscopy, pap smear, and mammograms. I'm sure saying today need that. Me touch on things that are important as women and not as healthy people that we are supposed to concentrate on. So my objective for presentation way say you be we no not at least when we are supposed to get a colonoscopy. Omuka say bowel prepper, which is near omoma unum before obey colonoscopy. No, the right way to do it. You pap smear age that is recommended, and also mammograms. All right. So the first thing I'll touch on is going to be a colonoscopy, no, and the colon cancer, no, and then the fourth most common diagnosed cancer in the US. Colon cancer is the fourth, but breast cancer na first, which is the most commonly diagnosed one. So before, no, that recommendation was that at the age of 50, that's the time we should be getting colonoscopy. But recently, no, sir, a change here. So I'm more recommend this instead of 50, no, say age near 45. And see, that's the first age we should all keep in mind. And the cutoff age is around 75 for most people. All right. So, like when they say colon cancer, when they war risk, or your high risk, into most of the times, no, because colon cancer, it's usually Black people. Because say African Americans, but basically what I mean is Black people. So we are more about 20% likely to get colon cancer, and 40% more likely say obibini unya colon cancer, obitimiu from it. So obviously it's extremely important say we should get routine screenings. Sometimes you may test earlier than recommended age now, which is 45 no, based on certain risk factors to say, or or family or being colon cancer at an early stage. Those are some of the things you need to keep in mind. There's other genetic disorders that we look at. One of them is called I'm sure someone said the Crohn's disease and now ulcerative colitis. And here one of the ones that say if you have it in your family, you always want to test earlier than the recommended age of 45 now. All right. So colonoscopy, basically a diagnostic test, which means only diagnostic colon cancer, but it's also a screening test. And what the test is about is that it looks at basically cancer cells within the your colon. So screening they are usually classified as either a invasive and not say any invasive. So if we want to consider tests that are any invasive, no, better to say nim Cologuard near you go to the bathroom normal test to see say if moja ewo or stool no more. They also have another test called the FIT test, no, and also another one and also a non-invasive test. There's another one and no I'm testing for DNA and which is called Gardner and every 3 years and now and no. One thing we have to remember is that test too now. Sometimes we have what we call false positive, which means results make us say, yes, oh, moja was too, no, but it's not really true. And then we have situations that sometimes test here, not aka say they only moja, but it's actually a wrong test. So, a normal from the false negative results. So colonoscopy and the gold standard for if you per se a diagnosis will be with colon cancer. So during the procedure, no, what the surgeon and our GI person is doing is say, obeshe colon no, na wafa cells na a woman. There are certain particular cells that we look for, and yes, cell of BR, but what we call malignant cells, that's what you concentrate on. Malignant cells is another way of saying say cancer cells. They have another version of colonoscopy, and no, friend is sigmoidoscopy. And no, time you say, although a type na, and no, if we walk, BB to say cocoa, and then manama, and then sigmoidoscopy in the air. And no, it only looks at the lower portion of the colon. No, it doesn't look at the whole entire year compared to colonoscopy. And so usually we prefer the colonoscopy versus sigmoidoscopy. No. Nti omuka say bowel prepper. And I'm sure say you know I take bowel prep no, but one thing we notice say, yeah, people don't do it the correct way. Into sometimes results ne ba na omaka say test no inconclusive and I say maybe near not omo person oma. So bowel prep now I'm sure say in nine yeah omo no one mix it with go lightly. Sometimes it may recommend say fat and stew mix it. So most of the time around like 3 p.m., maybe the day before procedure, and now I start it and every 10 to 15 minutes be and now I want about maybe 8 ounces of the liquid. And then usually early in the morning, no mama wa fat pill back home. Now, and no, the goal is that bowel prep no person we any year because the goal is that on the scope no era more. They want to make sure say just say intestine ni more I clean. There's no stool and a baby sasa no a bit allow surgeons to directly on visualize it colon ni without having any like resource at IMP. However, there are certain foods that we usually say don't eat before the procedure. Um, Another thing say we always recommend, of course, eat only foods that are low in fiber the day before the procedure. Now during that time, now we'll prep it for the procedure to happen. No? So any kind of adriania like color womb to say maybe to say red, blue, all those ones no interfere with test. No? So we usually do not recommend these kind of foods prior to you getting the procedure. Um, Other things like enama moja wom, so red meat, maybe to say broccoli. We don't recommend it. Carrot say yellow. We don't usually recommend those kind of food. Maybe to say cauliflower, grapefruit. Just say I won't say color woman. You don't want to take those foods before obenya colonoscopy no, because of these false positive results. Okay. One thing you want to prevent is that only new anyway. So sometimes not omako hu bibi miha enye it will lead to obviously further testing na and also na ako twin bibi na aye kuntan. Nti colonoscopy no and no major no and then I'll jump on to pap smears. Okay. Yeah, we are any question be a mobile me bisa. So my next topic I want to touch on a pap smear. So pap smear obviously it's a test that you use it to test for cervical cancer. Obviously, cervical cancer is one of those very preventable diseases or treatable diseases if it's caught at an early stage. Obviously, you can prevent it by routine screening, making sure you're seeing your primary care doctor. So what the pap test does is that almost lower parts. So over cervix ni say lower parts no ehona yeah fat cells no from. Okay. We just take a thin layer and then we test the tissue for any kind of presence of any abnormal cells. Okay. So anytime with cells no around the cervix no becomes abnormal. Most of the time it's from the virus that we all know as HPV, which is the human papilloma virus. You have to remember sometimes your body can clear human papillomavirus without any issues. Okay, so any time bia or be positive for human papillomavirus, that means obenya cervical cancer, and they be. So when we go in for the test, we look at certain things, okay? But before then, the recommended age over started pap no is 21. First, not the age was 21 if like you are sexually active, but it's not the same again. Now 21 no. Whether you are or you are not, no, you have to test from that age onwards. Okay. How often are oba be tested for test no? It depends on who health history. So everybody's own varies, okay? But these are the recommendations. So usually recommendation between the ages of 21 to 29, no, they always say test every 3 years, okay? They can also do what we call just over testing for only HPV virus no onko. And usually they recommend we do 25. So from 25 to 29. Then the recommendation that ubetimia only pap test no HPV testing no. Then starting from age 30, echo 35 ho baby. You can do what we call co-testing, which means ubetimia testing for both HPV, no, and then you can also do a pap smear. And no, yeah, it's every 5 years. Okay. Or and that's only HPV testing every 5 years. The American cervical cancer screening guidelines no more recommend this at age 25 with HPV and having HPV testing every 5 years through the age of 65. So and then cut off. Okay. A little bit about cutoff age, no. Okay. So cutoff age, if you've had consecutive normal pap smears, and on that age cutoff near 65. You have to remember before me can say it depends on your medical history. If at some point, maybe before the age of 65, no, you had an abnormal testing. Sometimes they can go beyond the 65 years on better. So say if say okay obi abnormal cells they look at what we call high grade. Okay, high grade which means cell now a service no, you are most likely to develop cancer a little later no. Those microphone now you fall within that category. What they do is that they will do further testing. Having a positive HPV test doesn't necessarily mean say cancer or cervical cancer. It just means that you are at high risk of developing it because cancer, it takes many years to develop. It's not immediately. Yet, HPV, certain strains will have a cause cancer or are highly likely to cause cancer than other strains. So, for example, strain 16, 18, those are the strains that we usually look for at our lab. Okay. Most people know almost clear the virus at a very young age without even it getting to that stage, say, because cancer. So almost certain procedures are to remove the abnormal cells. So for example, we will be a test no, be around cervix no. Procedure back friend a leap. So it's just like a loop electro excisional procedure. Another one they call conization into they'll drill a hole. It's like I say cone or cervix, no, not section no, of any abnormal cells that are there. And most people know yes, they are okay. You don't need any other procedures. And then it's just routine. You continue with routine monitoring. Another procedure, I'm friend freezing into an acid cryotherapy or my freezy cells no, around the cervix no, so that they don't grow or become more abnormal. All right. You always have to remember that an abnormal cell does not necessarily mean that you have cervical cancer. It just means you are high risk of developing it. There's always options obviously available that you can discuss with your primary care doctor. My next thing I just want to touch bases on is mammograms. Mammograms, we all know what it is. It's also routine test, and I know you diagnose breast cancer. Obviously, the goal of mammogram is that you want to make sure that there's early detection of breast cancer, obviously, so that baby will have but they'll intervene at a very early stage. So mammogram is basically a form of X-ray. They use that and then they create images of the breast to find anything that is essentially abnormal. Omo bakwa a 2D, and then they have another one a 3D. Okay. The ultra usually omo BB a abnormal or mammogram no more. That's when we do an ultrasound. Okay. So the ultrasound would further assess, say if what maybe mass what no for no that they need to do something about. There's another one, I know I'm friend the dactogram, but time you see biome. Okay. And I know yeah, almost share any kind of what like bloody nipple discharge and not almost but MRI is also used as well during this time. But I don't know how use for more high risk patients. Okay. So there's several approaches surgical wise. So who say BB abnormal woman or things like lumpectomy or mastectomy. And then one of the other ones are so in the US, no, recommended age between like 40 to 75, but that is based on US preventive services or more recommended say started around that age. And then the recommendation is every 2 years. But obviously, the American College of Radiology and the American Cancer Association, they recommend say you should start at age 40 and then like more like a yearly yeah, Canada for so or more recommendation. Say over started around the age of 50 to 69, and then but you do it every 2 to 3 years. Okay. One thing we usually recommend is that mammogram, don't do it too often. Okay. The reason why I make concern is because sometimes just the anxiety of getting a mammogram and our surgery, it's me and my doctors pay test a hold it's not necessary for you to go through those tests. So obviously another thing is mammograph because X-ray. Remember, X-ray, you are being exposed to radiation. Into that one, to you kind of put yourself at risk. Say, like you're getting a lot of radiation to your breast, and you could actually end up developing cancer years after. Usually mammogram, I would say maybe like very dense breast. I saw no for mood. And yeah, they go a little further to investigate because those kind of man usually it's hard. Press it, it was what say any kind of mass and baby woman, it's harder for them to be able to pick it up. All right. I'm sure saying I need self breast exam. Although ABB, we've always recommended. It's one of those things that like OBGYN, they'll do that. But it's not really a test as you use to or we actually depend on. So Obabia, oh sorry, first thing you want to do is what you bra not wash it. But me a mirror. Into mirror muna, you take a look, not wash your breast, no, just outward how it looks. Say dimples be more or nipple no any discharge woman or anything like that. Or babia say wouldn't be a will breastfeed and I say who breastfeed, you shouldn't have any kind of discharge. Say nipple no, you shouldn't have ensure say APA and bisa. So those are the things you want to look for. Next is overshare around no for no any dimples woman, which means like holes. Okay, we say over anka the way anka na chino etieno. You want to look for that. Obviously, you shouldn't have that. Okay. Or Barbia shouldn't have those kind of dimples around there. So those are some of the signs you should be looking out for. So, so we exam now. Usually we take stand and then now the eto where you susano your breast is more accentuated. Shape ni na ewo na what the ones say, and then you palpate around it. Okay, and near like bibi a ya po bibi a wa nhwe a enye it's abnormal. Those are the things that you want to be looking out for. And the next thing is say why yes no na ode one sa no we mia no pelnano to see say if any ensure air back. You are not supposed to have any kind of discharges from there. The next thing ubetimi ada. You do the same to the other breast and then you lay down. Okay. You lay down and then do the same thing. Apo. But one thing I'll recommend is that make sure it's not during your period. Okay. The reason is that when say obabia your period and not almost well yeah because of estrogen in tiano. Into sometimes when say your period are not already apo for her. So and no bet me misdiagnosed. You know, like I say, oh, you feel lumps, but it's not actually lumps. So we usually recommend say if you maybe a week or few after your menses, no, that should be the timer or you should do the self-breast exam. I'll stop here and then I'll give chance to the other team members for them to also give their presentation. We are not be floor for questions. All right, that's it.
Yeah, Dr. Azira Yadase. Sisi ana mefre Sister Vida and Sister Grace. Ombema the definition of menopause. I'm sorry, Sister Lydia and Sister Grace.
And yeah, Sister Grace has said quite kakra. The definition of menopause. Okay, what is a menopause definition? Menopause is Menopause is the permanent cessation of menstruation result from the loss of ovary follicular activities. It is a do maybe a buy ye period be ye trabra. Into at that time, no normal baby coso and son a brechano aba. Into most of the time, no, ye can say Uber monitor, Uboha, a best start say every other month and a month brechani best start. Uboha every 2 months. Na unyanya period. Na emfi a start saa no say no omo say yetimi ko up to 45 years first ne de na wo 50 plus and sana wahu saa betwa no ba ene de enti saa if 45 years bia no na betwa no start na wonya ho symptoms nti epesa wo monitor at least for 1 full year no wanya betwa wanya period afei no yehunu say ampa wanya menopause. That because to say na America no normal be best sound ovarian function. The ovaries produce estrogen and progesterone. This hormone regulate the menstruation cycle, fertility, and other body function. To say bibi a etu ye kosua ye deniam. And no your hormones prepare hormone. And no sa hormones no prepare kosua no. So so many so now sabe nyinsen ama. Saa kosua ne na sei ene normal keka ho nyina no ene beye bra no enti saa hormones no betwa ne statia saa hormones no function ne sesa enti finally no bia ese we betu kosua no bosun we na nka kosua na anya ba no na beye moja no saa month no bia kosua no ema bi because almost na say e ma produce sa kosua no asesa ekofom ena sent eno na me kire ekofom ntino kosua no entimi nsan to bi the pathophysiology of menopause as a woman age ovarian follicle decrease reduce estrogen and progesterone there was a 2 months no mo ne control sa kosua na make e fe ba ko estrogen and e fe ba ko progesterone. Na ne nyina so free trim a yefen hypothalamus particular pituitary ovary axis is disrupt. At that time no ne nyina free adwene. Ibi wo ya adwene yefen hypothalamus eno ne control sa hormones no ema ene ye adwuma. Na edu sa age na America na eno ma nyina asesenti no the control of that brain that part of that brain no enye adwuma ma hormones no so entimi produce. Nti low estrogen nti decrease FSH and LH due to lack of negative feedback. The estrogen deficiency is the key driving of menopause symptoms. Nti tisa na meka no ne nyinaa fi deɛ wɔ hormones na balance nti sɛ wohwɛ na edu baabi a yɛ mmaayewa ne si so na bi a sɛbi anaasɛ wonya yareɛ bi koraa te sɛ fibroid a yɛfa no sɛ ɛsɛ ɛma waduru a ɛbɛsesa saa hormones no adwuma anaasɛ wokɔda birth control so a saa hormones no yɛ use for the same birth control sɛ sɛbi ɛbɛ slow down na ɔnwuo anaasɛ bi a awoɔ no ɛma eti the same thing sɛ the same hormones na ɛwɔ yɛ adwene ɛno na ɛbɛ control sɛ yɛbɛto kosua na ama na asɛe abɛyɛ mogya. Enti that's the definition of menopause. Nti hormones nine na ɛsesa. The estrogen ni bɛkɔ fam, the progesterone no nso bɛkɔ fam, and the FSH bɛkɔ soro, and the LH nso bɛkɔ soro. Ɛno ɛna ɛyɛ the problem. Nti systematic no yɛbɛka ne sɛ menopause is a natural biological process caused by the loss of ovary follicular function and estrogen production, affect multiple systems due to estrogen deficiency. Understand the pathophysiology help in managing symptoms of effectively. Until that time, no, and no more baby our body because the same kind no, so almost narcissism, I dream of hypothalamus assessor, your body nankasa so ebesison, and no na yen ya for a back come home, asem, mayehu, and that must.
Thank you.
Sorry, Simpacho, or the mute. So now that's the mute.
Sorry. Sister Lydia, that's it. So, what the definition of menopause? Sister, I bet first Sister Alberta and Sister Mavis. The signs and symptoms of menopause. And Sister Mavis and Sister Alberta. More muting.
Sabes ampacho be starting ana. Me starting. Okay. Macho minti sister better and kinti. Me starting. So over starting so ano ama me ho. Minim so osompo a. Okay, nti you do symptoms of menopause. Symptoms no edoso, but ni titiri pa baako a yɛn nyinaa yɛbɛdi ho adanseɛ sɛ ayɛ na mpɛn pii no yɛtaa ehu ɛyɛ yɛ period a anaasɛ yɛ menses a ɛtaa most of the time no ɛno ne adeɛ a ɛdi kan ɛsesa ɛma yɛhu sɛ seesei yɛyɛ akeka aduru saa stage a yɛfrɛ no menopause no ɛna sister deɛ yɛ sister di kan kaeɛ no odi kan bɛ define yɛ no ne nyinaa gyina hormone bi a ɛfrɛ no estrogen that changes no do saa time na wobɛhu sɛ saa hormone no ɛkɔ fam ɛwɔ yɛ nipadua mu yɛwɔ dodoɔ a yɛma no ɛwɔ yɛ mu ɛno na ɛboa yɛ ma yɛtumi wɔ ɛyɛ nneɛma bebree ɛwɔ yɛ nipadua mu but sɛ wonya duru saa age no a ɛyɛ menopause no a wohu sɛ na ɛkɔ fam nti ɛkɔ fam a afei na yɛ period no ɛtɔ da a ɛma wohu sɛ ɛstate a yɛfrɛ biribi perimenopausal stage saa peri no yɛ before menopause nankasa no ɛbɛduru no saa stage no wobɛhu sɛ na wo period no ɛwɔ hɔ a sɛ na ɛtwam kakra ebi a sɛ wonya ne 30 days ana 28 days bi a wobɛhu sɛ afei deɛ ɛtumi do 60 days koraa no na ebi afei na baako a ɛde aba nti ne nyinaa yɛ signs ɛbɛkyerɛ wo sɛ sesei woyɛ akeka akɔ menopause ebiem ɛna yɛdi kan yɛ ovulation no so ɛka ho. Ovulation no ɛduru saa time na ovulation no so ɛyɛ unpredictable. Wontimi predict sɛ even this stage no anaasɛ ɛnɛ like every month bi ɔbaa biara nya go through ovulation stage, but ɛduru saa stage na te sɛ menstrual cycle na no, the more na menses no yɛ affected no, obviously no ovulation no so anaasɛ saa period no so bɛyɛ dɛ ɛbɛyɛ affected. Nti wobɛhu sɛ woanhwɛ yie koraa mpo a wobɛte w'ani no wofii sɛ saa time wei deɛ ɛyɛ wo safe period, nti no wombɔ wo ho ban, wobɛtumi afa mu koraa yɛ dɛ abɛnyam, because saa stage no duru a wobɛhu sɛ ovulation time no nyɛ consistent anaasɛ ɛnyɛ regular. Ebiem ade baako paa so a yɛ na yɛtaa hu wɔ menopause age no ɛyɛ heart flashes no ɛyɛ simple sɛ wobɛhu sɛ wɔ hɔ a na ɛhuhuru asɛ all of a sudden na ɛhuhuru ɛdew na asɛ wo feel so warm, especially yɛnim yɛ face ɛne yɛ neck, around the neck ne yɛ chest area no nyinaa wohu sɛ na wo feel so warm, ɛyɛ wɔ sɛ kuhwie nsuo nwunu yɛ de ɛfɛ gu ho between ebia 1 minute to bia 10 minutes na wo feel saa symptoms no. Ebi wɔ hɔ koraa so anadwo wo da wohu sɛ na ɛhuhuru de like ɛdew paa kyɛ sɛ woyɛ wo ho hwee a ɛnyɛ yie na wo ho yerayeraw, nti ɛyɛ saa so a ɛyɛ affecte wo sleep no, wo nna yɛ mu nyinaa bɛsesa, wohu sɛ wontimi nna because ɛhuhuru dew, ɛyɛ wɔ sɛ kodware, ɛyɛ wɔ sɛ sɔre horɔrɔ ho, ɛyɛ wɔ sɛ like wobɛhu sɛ ɛnna ɛwɔ sɛ woda ankasa koraa no wontimi nna, nti no sleep disturbances ɛyɛ so ɛyɛ adeɛ baako a woduru saa stage no a ɛbɛtumi de ayɛ dɛ ɛde abrɛw. Afei so no the more na wontimi nna wo ho yerayeraw, ɛfrɛ ne sɛ wo estrogen no so asa ate no ɛbɛsa affecte wo weight gain. Woanhwɛ yie a wobɛte w'ani no na da biara no na woyɛ dɛ kɛseɛ na woyɛ dɛ woyɛ, especially baabi paa ɛbɛtaa yɛ kɛseɛ yɛ wo abdomen anaasɛ wo yɛfunu side hɔ no, wohu sɛ na abere biara no woyɛ kɛse. Adɛn nti a because wontimi nna. Enipa time a ɛwɔ sɛ yɛde da no ɛboa yɛ, wotumi nya enough sleep a na wonya a sound mind a wobɛhu sɛ boa wo digestive system na anaasɛ metabolism ne ma biribiara ɛkɔ wano. Nti saa adeɛ ne affect a wobɛhu sɛ na wontimi nyɛ dɛ like woyɛ kɛse na wo ankasa no wo nipadua ntimi nsisi ne ho so sɛdeɛ ɛwɔ sɛ ɛyɛ. Ebiem mood changes and irritability. Wobɛhu sɛ ɛma bebree anaasɛ those stages na ɛna ɛfrɛ ne sɛ wo ne maame bi ana wo nana bi koraa te hɔ a wotumi ka sɛ ade wonya menopause ana, because ɛwɔ hɔ a bohu sɛ na ne mood no asesa, ɛwɔ hɔ a na wayɛ nice kakra, ɛwɔ hɔ a na asɛ ɔno ankasa ne ho yerayera no na wɔn ankasa wɔn ho deɛ wɔnyɛ nti na wobɛkasa ne ho koraa na ɔyɛ dɛ ne bu afu anaasɛ ne bi kɔ ɔbɛyɛ dɛ ɔbɛ abɛtea wo. Ɛno so ɛyɛ ade kakra bi na ɛyɛ na ebufu ɔbɛkasa saa na afei no wahu sɛ sɛ nipa na wo ne ne te no waduru saa age no na wahu sɛ deɛ wobɛsi ne natena. Ade baako nso so ɛyɛ memory loss. Wohu sɛ ɔntimi ade kakra bi na ne like ne werɛ fi keys koraa wɔnhu baabi a wɔde ato, ɔfa adeɛ a na wɔde ato baabi a wɔde bɛto no wɔnkae mpo, ɔsɛ adeɛ no ne kura mepa wo mmea menim sɛ adeɛ yi aha na mede to yɛ like ɔnkae. Wohu sɛ ɔbɛgyina hɔ saa, wohu sɛ na afei no ne nyinaa gyina menopause age anaasɛ estrogen yɛ a yɛka ho asɛm yi a aba fam yi, ne nyinaa na ɛkɔ so saa memory no ɛma no yɛ dɛ take some lapses bi wɔ w'adwene mu. Ɛna afei ɛduru saa time na ɛnam sɛ wo werɛ taa fi nneɛma wankasa wontumi keep track on wo daily activities nti no wobɛhu sɛ na afei wo lose concentration ɛwɔ w'adwuma a woyɛ, fie adwuma a woyɛ. Wobɛhu sɛ sometimes wode aduane koraa bɛsi so woanhwɛ abɛte w'ani no na aduane no ase ayɛ dɛ ahye. Ne nyinaa adeɛ baako so no menopause no deɛ ɛde ba no. Afei ebiem ɛyɛ yɛn kasɛe anaa bones nim. Yɛ bones no ɛduru saa stage na wobɛhu sɛ na yɛ bones no ne heaviness anaa ne density no ɛyɛ dɛ ɛkɔ fam sɛdeɛ ne kɛseɛ anaa ne muduo esi tie no ɛma ne kɔ fam. Ɛno nti na woanhwɛ yie a wobɛhu a na woanyɛ dɛ wokɔtɛ hwe a na woantumi ansi wo dada mu. Adɛn nti because wo bones no emu ayɛ mmerɛ nti ade kakraa bi na ama woyɛ dɛ woyɛ di woyɛ I can say woyɛ di ɛdɛm anaasɛ woyɛ nya fracture, let me take it like that. Enti no edu saa berɛ no a ɛwɔ sɛ wohu sɛ deɛ wobɛsi a wobɛtena a wonkɔpira ɛmfa asɛm mmerɛ wankasa. Sister Lydia aba na
No, it's not about Abba.
Sister Berta, sorry. Sister Berta aba na Patricia Sister Berta apɛ sɛ ɔntoa so.
Mbacho yo mwa.
Patricia.
Mbacho mpanyinfo Christ asomdwe nka yɛ nyina. Hello.
And
Council.
Yo. Me pacho me sorry na me driving I got cut off. Me sorry. Me toa sister Mavis dear na okan no so a symptoms and signs of menopause. Yawo vaginal dryness. Say eduru samre na enem say estrogen akɔ fam nti. Mmaa no yɛn mmaa no dry nti sɛ yɛn mmaa yi dry a ɛbɛhwɛ ne sɛ lining no ayɛ thin yɛn mmaa no mu no honam no ayɛ thin nti biribi kakra na ɛkekaw na ɛyɛ wo ya na ɛhyehyew nti eduru saa mmerɛ no a infections deɛ yɛnyɛ bi papapapapa nti ɛno so wohunu saa signs and symptoms of menopause ne bi. Wobetumi anya UTI saa enya bibia problems with low estrogen. Ena eba ne saa so a ema no nkitahudie no enam saline na ye ten nti nkitahudie so ya nti na ema no na ebi so twetwe ne ho ne nyina saa. Yewo urinary problems say Johnson ebediwa yese adiwa wo Johnson wo ho wontumi control wobekọ na kitwe bi ne nyina ka ho wobɛbɔ wa na wadwonso wo ho wosere kura na wadwonso wo ho ne nyina signs and symptoms ne bi depression wobetumi nya depression said your sister kaaye no wa hot flashes ya ma wanda nti anope wani aye kaka wabre nti eba ne sa why depressed and na wontumi na nti na akofa depression aba na eche se wompese wodidi kura na wo hyedem na waye basa ni nyina ye signs and symptoms na ekwa echiri a ese uhu doctor because ense se ekwa echiri bebre yewo dry skin so esa estrogen ekwa fom nti your skin by dry na wo chọchọ na wo ho kekaw yewo palpitation wo behu se wakoma na ebo a wa wote se ebo krim ni nyina signs ni bi wenimfu ebetumi aye very tender wenimfu ahyehye aye se wote se emu wi wo se nsuo ba mu se nsuo fi mu ni nyina eka ho yewo hair loss edu samre ya na yetiri no aye mremremre na etutu kwa nti ni nyina eka ho ni say yes sister na aka bebre nti eduru samre ya vaginal dryness ni ade ya ahokeka e wompem ahokeka de na eche se wunni bi kura ni nyina aka ho ubenya headaches wuti betumi aye oyesa eche se ni nyina wo sa ne ya ni nyina aye signs and symptoms of menopause. Epenyufo say ya buru bebre so nti me de manu besi ha madam ase.
Sister Alberta and Sister Mavis yedamase. Sisia no yebeko the stages of menopause. And no see yebefe opening se wa na wa maye the stages of menopause. Opening se wa.
Thank you so much, Sister Rose. Samucho, your friend me opening sewa. My bread there, so mo fan chair. He said, "Juma ye de bo anko for no. Ye nyina ya kan bo mu de na de. E de begu mu so kakra. Ye check ra. Me de very 2-3 minutes na maybe. Na many posts no. Ye was stages ni ensa. first stage, your friend no perimenopause. And no, your first stage, and your transitional period. Because menopause wo hwe enye yare na emome yini na edeba said ye mpanimfo di nkan kan estrogen no say reduce ne ko lower na sanyo mani nyina eba but that first stage 45 to 55 years na start here na no ya na depend on the family history obusua no obi wo ho a 10 years stage 1 obi wo ho 2 months crown na baba ako eba so kra 1 or 2 days bi na eba obi o nso a ebeba every other month obi o nso a 3-4 months na baba ako enti depending on the history no and only the menopause no obi o nso a stages kakra bi ne symptoms e wo ni say obi o a eba ne sa na ne behavior asesa wa ye din obi o nso na so wa hye kasa ase obi nso anigye ani ade e normal na sa back to this stage no be emotional and physical symptoms if you also na ko stage 2 no dey friend menopause na nkasa no ye normal na age no so ye 55 to 65 e ho dey menstrual cycle no na say end area between 90% dey 55 to 65 no na 90% dey na etwa few a year umbenya near 10%. Still umbenya every month a year. Like I said, it depends on the family history. And also symptoms can see a pie won't be able to bibi kakra bi hwan edi we to ha hwan ye se onu kunu kratia na wan hwe ye a sa nyoma nketi we no wo hwe age na da bia ne tese di ebufu aba ofie ni heart flashes anajo tese na wo sweat anyoma bebre wo ni feeling tese ya dry I think no kra so ate enti utre anye ye no so nyoma ni bebre like you said no estrogen no low normal ni ye 30 to 400. Inti no below 30 ni de na tese nyoma bebre inti e besre mo moko hospital a moko mo primary care physician a mo check him amo obi o hane tese estrogen ni wo low kra nso no de unim se ukunu na ehye obufuo wadamfo bi na ehye obufuo we na eye o se nso bi ana ohia se estrogen no ebeba so kakra oba bi by hospital a middle age the first thing is say you check no ehun se ni level no between 30 to 400 no let us say you treat no aba normal kakra third stage no so your friend post menopause and the age of 65 going eba ni sadia na say I am the cra and the to say osteoporosis and the leading to physical changes no joint pain especially kotodwe and sa or con they also any so doctor catch them say estrogen level ni dey on check him out if they say you could be a woman chre say hia nti ko no mo check ya na dey ho no ya ma vitamins and say bibia e be boa e ma dey wo mo and ni stage saying and so no wo normal level be a friend of progesterone and no say a couple ma and say testosterone a couple ma levels ni kwa and so no utimi enya enyoma bebre a emmoa nti no me de ma no besi ha da mo asi bebre
Opani sɛ wayɛ da ase. Sisi ano ebi a yɛduru no yɛbɛfrɛ opani Rita ne sisters Christiana na ɔmama yɛ the treatments of menopause. Thank you.
Yo, sister Rose Medase, Openi, Mr. Wanidi ne Kasa. Pacho, many Openi reader said Yakano, ma the treatment, Na, ye share definitions about for menopause. In some menopause, a natural process in a woman's life, about wounding through stage be you pass through that process and share that you need treatment, you treating menopause not as a disease and it's a process that everybody will pass through. Name home treatment option no, is focused on the signs and symptoms now. Wunya so we do that stage na ebi mo enuanom bi edi kan aka ho asem no enti ya in two main categories the edi kan ye hormone therapy and non-hormonal treatment and two no lifestyle changes or home remedies and you may be a wabetimi aye wo fie a ebeboa wo with so we do stage na it's me make us about hormone therapy and hormonal non-hormonal treatment no we are opinion rate and so the home remedies no ever come and he said the estrogen hormone and to drew or menopause stage na eba form. But thank God to medicine, there is a therapy or a medical treatment that involves administering the hormone levels to a woman. Into hormone levels now a cough for me. There is a way you're able to me, they can give it some to you in the form of like medication. Now with a year signs and symptoms now all go through no. Na adeɛ baako a wɔsi ɛhyɛ no ɛso any sɛ wowɔ saa stage no or during that stage so wode so wɔ uterus anaa deɛ yɛfrɛ no womb na there will be a combination of wonya estrogen nko a it will be a combination of estrogen and another hormone yɛfrɛ no progesterone. The simple reason being that estrogen one of the side effects and it's it thickens the uterus wall no your womb no wall no magnetic and that alone can cause it's a risk for cancer. It is a do stage now with the so you womb but now uterus now it will be a combination of the estrogen and the progesterone. But say for some reason, if you don't have your womb in there any only the estrogen therapy or the estrogen treatment, no, and no kwa and ubinya. Nenye ni penila and a sad treatment way based on health history or family history. To say will be a history for cancer or blood clots. This will not be the best treatment for you. And because of that, and there are other medications and any hormones, but it can also help with menopause signs and symptoms. Something like a vaginal cream. Say yeah, can it because of vaginal dryness. You can get a vaginal cream prescribed one, Mr. One month, if you Vaseline and you be and what to talk to your healthcare provider based on what you as a person. You can talk and you have the best treatment option for you. Into vaginal cream or what and also bevoa with a year dryness no. And there's another low dose antidepressant medication back what the friend paroxetine and no and so yeah draw back what in a low dose yeah because don't say cancer for people go through depression stage or heart flashes and also if you show more I'm here who say it helps with that signs and symptoms. Another medication gabapentin. Typically, this medication is for seizures, but also there's been a study say and also with a year menopause signs and symptoms na you face no and in penny back your cassava your osteoporosis a year so bone density na ebe 10 your risk for fractures and bruises and all do stage now madam there are also other treatment options and also ewo hwa ebeboa into the year Kenya says there are treatment options to help manage your signs and symptoms no into it's very important you talk to your health care provider, don't stay in silence and suffer in silence. Then treatment, everything when you get into that stage. Into sabi mede mano ebesi ha na mejai de afa etwa so no ama opinion rate medamase.
Me penny for premature crisis soon being come. Opinion patcho Mr. O'Neill any day in the casa. So dear, your mamma and you medical akano. Your sister so aka a treatment no in afen. Na media your lifestyle any home remedies. Nti ade a wo fia betimi a ye wunhia doctor bia se obetro se ye anase beji prescription ne fakoto. Ebi ye hot flashes a ye nuanom ka signs and symptoms no. Ade bi a ha dwen pa na mum ade ba kwa wankasa betimi a ye ebema hot flashes no aba from kakra e de ama woni. Se abreni na wo feel those hot flashes no a wo fan nketenkete bi wo ho a wonam bi e se wo bi e wo bag ni wonya felipa na waso se ne be cool down abribia nso mansuo enwo ho nsuo enwu no kakra na wanom ebe cool it down hwɛ nneɛma a trigger obi wɔ hɔ a ɔnom coffee a na ɔnom tea nsu ade a ɛhye sɛ coffee na ɛhye sɛ tea na ɛhye ɔnom a na aba gidigidigidi hwɛ nneɛma a trigger sɛnea ɛbɛyɛ a wobɛhu ama ɛba a wohu sɛ adeɛ wei na ɛyɛ a menom a na meyɛ a ɛtae ma ne ba anaa wodi spicy food paa hwɛ ne yie na wohu sɛ wei saa adeɛ wei medi a ɛma ne ba saa woyɛ obi a wopɛ nsa a hwɛ no nso sɛ abere bi a mɛnom nsa biara ɛda a mɛkɔ party anadwo a mɛba bi a mɛnom corona baako a mmienu bi anadwo no mentumi na me hot flashes ne ba paa wo steady a wobɛhu sɛ ɛyɛ wo trigger na kyerɛ sɛ woatwitwa so anaasɛ woagyae koraa afei nso make sure sɛ abere bi a wo room ɛyɛ cool ɛnyɛ baabi a ɛyɛ warm abere bi a wokɔ baabi a pɛ baabi ɛhɔ yɛ cool sɛ picnic koraa na yɛbɛkɔ a pɛ dua bi ase na kɔtena sɛnea ɛbɛyɛ a ho bɛtɔ sɛdeɛ yɛn nuanom adi kan aka no wobɛnya dryness ɔbaa wo baa no ɛbɛyɛ dry ɛma fie nyɛ dɛ da bia na akunu bu afu ani gye ani fie na mmom yɛwɔ jelly bi a wɔtɔn wɔ CVS Reed yɛfrɛ no KY jelly wokɔ a na wokɔtɔ bi a wobɛtumi ayi so abere a mpa agorɔ mu ɛkɔ so wɔ mpam woyi so ɛbɛtumi aboa na mmom hwɛ sɛ wontɔ deɛ ɛyika ne sɛn glycerin ɛwɔ mu ɛno ɛbɛma wo burn ɛbɛma no ahyehyɛ wo mmɔ nti pɛ water based lubricant a ɛno no woyi so a ɛbɛboa wo ama wo ho atɔ ɛbɛma anigyeɛ nso so aba fie saa ara nso na ɛtwa sɛ ɛyɛ sɛ wonya enough sleep sɛdeɛ nnuanom adi kan kaeɛ na anadwo koraa bɛhu sɛ hot flashes yɛ aba woda a wontumi nna wo ho nyɛ wo yie abere ne abere bi ahwɛ adeɛ a trigger sɛdeɛ medi kan kaeɛ no sɛ wobɛda ebi aka 1 hour 2 hours ma bɛda na ebi a wode wobɛda bi a te sɛ wonom corona baako a gyae because those are the triggers gyae ebi a woba bɛda bi a aka 1 hour 2 hours so medium pɛ coffee paa na wanom bi ɛbɛ trigger wo ɛbɛba ɛno nso so ka ɛbɛyɛ yie a twitwa so sɛnea ɛbɛyɛ bɛtumi aboa wo ama watumi ayɛ exercise yɛ very good but ɛnyɛ sɛ bi a woda 8 na 6:30 7 wokɔ walk tententen gidigidi ɛba a woba a ɛbɛ trigger wo nyɛ adeɛ a wobɛtumi ada nti yɛnhwɛ hɔ ne yie sɛnea ɛbɛyɛ bɛtumi anya enough sleep so ara nso ɛne yɛwɔ ɛka ne sɛn relaxation exercise bi a yɛyɛ techniques bi a yɛyɛ wowɔ hɔ a you breathe in and breathe out you breathe in and breathe out sɛnea ɛbɛyɛ ɛbɛ relax wo muscles no ama wo nso wo ho ayɛ den asane wɔ sɛ wopɛ yɛfrɛ biribi guided imagery ebi a adeɛ bi a ɛma wo stress so ɛte ba fam ebi a wowɔ hɔ a imagine something ebere bi a wokɔ beach sɛdeɛ na nsuo na asɔkye na ɛbɔ no calm wo down just imagine it in your mind ebi a wofiri New York ɛkɔ Pennsylvania the scenery ɛkwan no so nnua no ne adeade wo calm wo down those things na imagine it in your mind ebi a Ghana na mokɔ afuom anaa mpo mu to kwan afiri Kumasi akɔ Accra kwan no so nneɛma bi ɛyɛ mu ho a ɛyɛ wo fɛ just imagine it ne nyinaa bɛtumi calm wo down ama wo stress so aba from your first exercise be a friend is saying pelvic floor exercise needing the Kegel exercise Kegel exercise a boapa or baby our house or ham kakra one ham jam a bois or pelvic floor and mano a relax it. It sounds so bois with urinary incontinence and necessary Alberta Ekan because you are all those things that kick in. Na ɛha wo kasa wo sere kora bo nso wo dwen so stress incontinence meaning na ɛboa ti abere ne abere bia wo yasa Kegel exercise wo ham na wo jam every day and at least 2 or 3 times ebetimi aboa wo ama no ayeyi your balanced diet say ha ehwe ne yie fruit and vegetables are very good and ahwehwemu so atro say fruit bi to say oranges blueberries all the berries banana nomni ade na antioxidants bi a ɛboa with all those hot flashes no nti no sa abrenya bibia wadua ne mu wo sa nnuane ni bebre ɛwom sɛ ne ɛbɛyɛ a ɛbɛboa wo we de menyini si ye bibi mamu de bi wɔ hɔ but you never know omo nom jot pa na say yi we smoker this is the time I say we die because anything about trigger ama when you hot flashes ne say we twitwa so smoking is very, very bad. A boy man can say me in our from Emma cancer and so Emma heart disease. And it's a way your bar na wo time nom jot wa ebrewe edura ekasa like ebeboa wa pomudini mu ewo wakoma mu ebe prevent from getting cancer, osteoporosis, the stroke, the but hot flashes, one of the triggers, and regular exercise, abbreviate exercise at least every day with 15 minutes be walk. Well, we fear so wouldn't me and call walk maybe as no be at our staircase be a coca crabra, and also bit to me up wow ama or can say about coma. Yare bebree na associated to menopause, even though your estrogen no ɛwɔ fam no ɛboa w'apɔmuden ma wotumi ho eso etimi ɛtɔ mepakyɛw mewie sister Rose medase.
Penny etane Sister Christy yedamase. Sisi anya befre Sister Abigail my beneficial supplements for menopause.
Yo, openi misle wani die ekasa. Me side ne ye supplement no. Sena ye te no menopause no is mainly say your hormones no abafam. Enti say ye fa nyema ebeboa with balancing our hormones no. Me fa plant-based things ɛboa ma yɛ balance your hormones no because nhwehwɛmu ehu sɛ plants bi wɔ hɔnom a ɔmo naturally ɔmo wɔ phytoestrogens a ɛboa ɛma yɛ balance your hormones no bibi te sɛ soya beans ɛboa with menopausal symptoms and also balancing our hormones. Flax seeds so adeɛ bi a ɛboa. Ginseng biribi a ɛboa mood booster ɛna san ɛboa with improving our sleep. Yɛfa red clover ɛno nso so yɛ adeɛ bi a wode incorporate wɔ w'aduanedie mu a ɛno nso ɛbɛboa. Sɛnea ɛkaeɛ no because yɛnyini na yɛlose yɛ bone density no, we are always prone to having osteoporosis. Nti ɛduru saa menopausal age na na ɛsɛ yɛ increase yɛ calcium and vitamin D. Mostly we need calcium, but vitamin D ne na ɛboa ma your body no absorb calcium no. Apart from say wobɛfa calcium ne vitamin D no, wobɛtumi incorporate more yogurt, beans, almonds, sardines, broccoli, kale. Saa nneɛma no so ɛwɔ more calcium, vitamin D a ɛbɛtumi aboa aboost wɔ calcium levels no. Na to prevent all this bone density loss. Ɛba aduro afam a multivitamin bebree wɔ hɔnom a for adults. Centrum ne ade wokɔ most of the pharmacy shops now ɔmo wɔ multivitamin for adults ne ade wobɛtumi apɛ bi. Magnesium so ɛboa for hot flashes, mood swings ɛna ɛno so ɛboa yɛ improving our sleep. Omega 3 so omega 3 yɛnya wɔ fish mu, but wopɛ sɛ wo supplement so a wobɛtumi anya omega 3 ɛwɔ pharmacies no. Saa supplement nyinaa ɛyɛ, but ansa na wobɛfa supplement no sɛ ɛbɛyɛ a ɛsɛ wo ne wo doctor ɛkasa, because ebi a eduro bi a wonom no ebi a na supplement na anasɛ biribi no ɛne ne ɛnhyia. Nti ɛsɛ woma wokɔ wo doctor hɔnom a supplement bi a wotɔ bi a ɛsɛ wode kɔ na wo doctor ɛhwɛ sɛ ebi a components bi wɔ hɔnom a ɛne aduro a wonom ɛnhyia ansa na wafa. Because although says those supplements will boost your help you reduce your menopausal symptoms. Maybe so na sande at the foforo so aba. Say adeɛ bi plant bi friend no black coal hash. I am very popular in the US and for edi ho dance say eboa with menopausal symptoms. But first so say offer with caution, because most of the menopausal drugs now these vitamin shops, it has that component of black cohosh, something that is predominantly used by the Native Americans or more mostly females for menstrual cramps, and it's been known say a boy with menopausal symptoms, especially hot flashes near them. But it's also been known say it's also one of the things that might lead to liver diseases. Until far you have to take it with caution. Until na me can say so we toss supplement biya for menopause symptoms fa kɔkyerɛ wo doctor na ɔnhwɛ with ɛnhwɛ sɛ ɛnyɛ wo aduro bi a wofa ɛnhyia. Nti me deɛ I always suggest using the plant-based ones, that is more natural way of boosting your hormones than buying any other herbal medication. But as a make ma wo doctor ehu na wɔnhwɛ sɛ ɛne w'aduro bi a wofa ɛnhyia. Meda mo ase.
Sister Abigail, that was to see an baby I drew and then a question and answer. Team Pamucho. Open so bisa questions. Obet me amounts as so Zoom so. Another way so say open so ultra chatting so I'll bet me yes into two Pamucho per se one at a time and I enjoy more than multiple questions, not answering now.
Think multiple will help.
See, you better me na after the third question, and now you jam mama healthcare professionals not I answer. Team Pacho, one what question? Pacho nanasa. Can you say one more answer? Pacho to me kasa. Pacho on YouTube.
Okay, I feel the
Pacho.
Yo. Na omo kasa no na say omo se dabra oba abre wankwa. Oh sorry. Say bia wodi be 45 for ho kono a. E na ya na menopause na eba. Na mpese mbusa on say bia obi wadi be 30 ana 35. Akoye thyroid surgery ana say akoye G1N surgery bia mo friend say e bia total abdominal hysterectomy bilateral oophorectomy. Okoye sa eyi a mepacho sa nipa obetumi anya hot flashes ana
Yes.
de din kan de toso mienu say or treatment no kan say estrogen replacement therapy. And estrogen no say insunsanso u take estrogen replacement therapy na insunsanso bi wo ho a te say bia obetumi anya blood pressure ana. And my questions are that's
Thank you, Nanasa. Pacho Sister Ama. Good question.
Yes, Rose Patrol me dasi. Me patrol yeta ko hospital na o fele forms a. Na ye bisa o se wo ye tuntum ana se wo ye kokko fufu. Na mpese me who what was the main reason for those questions no patrol? Dr. Kasano can be say mostly na blacks no enya ne best 40% enya sa yare na no wobobo so. Na mpese me who say reason be you behind the ntino de bia no sa de no mo di bisa ye na me pacho me dase.
Pacho Nanasa questions me and then Sister Ama question. Sure, one never started.
You're saying so. May answer and ask a question. And press her at age of 30 now or complete hysterectomy. Yes, you get the a year, you be uterus no, you be fallopian tubes. The best time you ovary now, a produce estrogen no, any progesterone no, ye and no so free ho. Until end of the day no, a mechanism a menopause abeto kwan mo pe o mpe abeto. Nti wobɛnya the same symptom to say ɔno a wanya 45 a ɔkɔ ne normal menopause because wo deɛ no yɛafoɔ so ma yɛyiyi saa nneɛma no nti you will feel all these symptoms. Ɛyɛ nokorɛ so sɛ progesterone therapy no it can be a lot of consequence. Mekae sɛ yɛn nua no ka no ɔkae ɔse ebetumi ama cancer which is true. Nti yɛ na doctor for and recommend it too much. Ya na ọmụ pese ya nkasa no body no yesua say ya be adjust the changes no with time it become better. Sini say cause therapy ti say na o panyi retake natural yi ni ye better sini say ya di ho ba kototo saa hormones no very dangerous. Any cancer, breast cancer, uterus cancer, and normal ovary cancer nyina ni ɛsan yes kakra minimum madam as
Yo, mpacho, me timi di bisoso.
Pachan.
Yo, timi mpacho, no prayer nana. The question, timi also high blood pressure in some people. But na you can't, you know. Treatment is you weigh the risks and benefits. Depending, a bit more is so severe, say, maybe depending on risks involved. This is the point of view that the benefit going to for every treatment. You weigh the risks and benefits involved. So, what symptoms and yes, so severe now it can be managed. Always is recommended that you start from the low side to say via home remedies in any way. Something you can do and when you or any effect on you. But it's so severe that nothing can be done about it. Then definitely, only Dr. Kasa, like I said, based on your history, your family history, they can decide that this therapy is good for you and or not. But in any treatment, now as a person, even a gynecology, it has some side effects. But we always have to weigh the risks and benefits involved. So benefits no outweigh risks are of course go for that option. But the risks now when you later it will outweigh the benefits of treatment or medication for now. Definitely, that will not be the good option.
Yes, like we see that's it.
Miss
And
Pacho, me so metimi aka kakra.
Pachan.
Don't
Okay, kakra meka no say menopause no ne symptoms no ayana mpempi no severity anaasɛ sɛdeɛ menka no sɛ like sɛdeɛ wobe face no sɛ me deɛ me face no nkyerɛ sɛ bi a me no wososo wodu saa stage no a nkyerɛ sɛ also be face the same thing ayɛ na differ with every individual obi wɔ hɔnom a obetumi anya menopause koraa so na ebi koraa na obviously no like ɔnhyɛ da enya symptoms no the symptoms no yɛ as severe as another person yɛn nyinaa yɛdeɛ no nyɛ de ɛnyɛ pɛ wate aseɛ depending on nneɛma bebree obiara ne ɛka ne sɛ ne nipadua no sɛdeɛ osi receive stress anaasɛ sɛdeɛ stress a anaasɛ ade kakra bi a ne nipadua no deɛ timi n'ahoɔden timi yɛ de egyina obi wɔ hɔnom ade kakra bi naa no ontimi ngyina ano koraa na lead to another thing wate aseɛ nti no sometimes no ɛwɔ sɛ wohwɛ wo ho a deɛ wobɛtumi a receive no anaasɛ in terms of stress wise no deɛ wobɛtumi wohu wo ankasa wo study wo ho na hu sɛ okay adeɛ wei me menopause no ɛdi me nya a ɛno na ɛbɛkye sɛ how severe it is sɛ ne si yɛ severe de ma wo ɛwɔ sɛ wokɔhu doctor anaasɛ
Actual voice, audio, Nicole. No, is it me?
There'll be a call.
Sister Mavis, actual audio, Nicole. Okay. Actual doctor, not this time.
Yeah,
Yeah.
and let me person me answer Sister Charlotte the question no regarding blacks and DNT and sometimes local hospital ubisa questions ask you about race no. Yes, me cancer no, I mentioned something about colon cancer no, black people being more prone and we are also more likely to die from it. And the reason is because there's this actual gene now, almost friend KRAS, and research who say it's common in us here black now, mutation no. Anti mutation ne ba or cells no anti repair any abnormal DNA and no, it makes you more prone to developing cancer no. The other thing I make can say, there's other factors that we look at. Say most of the time before no health disparities, yeah, economic status, and anything in play a role. For example, maybe obi will have only be into the BI, instead of healthy foods, no fruits, vegetables, no. Maybe those foods are usually more expensive. Or best spending majority of the money on fatty. And these are all the things that obviously lead to yare. When you now play role, sometimes for no before no, we notice these sicknesses at a far more later stage. The other thing too is that access to healthcare. Also be only insurance. Maybe instead of obeko doctor maybe every 3 months and every year no on call because only insurance obetimi check by the time obey na basically or advanced stage and I say baby maybe not cancer na see that na spread and na more serious. That's it.
Yeah. Thank you. Pacho, Obisa, what question? Hello? No.
Yeah, so this is
Pacho, Obisa, what question? And
Rose, say will be the question at to chat now, so.
oh, okay.
So, me who say a question about or
Yeah.
so because say what's the difference between stool or called guaiac test and the Cologuard no? Into stool guaiac no, and on tested for moja in your stool, and the Cologuard test for the presence of DNA in your stools. Those are the difference. Also, can you elaborate on the importance of getting the vaccine? Into the no, a vaccine no, it covers some of the strains of the HPV. So yes, usually America almost actually at a very young age, some people 9 years of age, inject what? Remember a vaccine. So if they are injecting you now strains 16, 18, those are the ones that you'll be covered towards. It doesn't mean say if you go out there and you have sex and you contract HPV bioma, you might end up contracting a totally different strain of the virus. So yes, I would say the vaccine is important, but always remember 100%. That's it.
Show me what question actually. What's the maximum age with me and you have vaccine?
I know here
up to say I be up to 45 obetimi anya. But they start as young as around 9 years age.
Okay, thank you. Pacho, Sister Mandalina Fori, Pacho, wait me, this is our question.
But my question is, vagina cream and me penny for can was I will for our for an answer or baby. I was in the monopause and I supposed to use. Thank you.
Me pacho metimi abem.
Pacho.
Yo, me da se openyi mi so ni die kasa. Me pacho Sister Mandalina, KY jelly dear, a common name most household everybody knows. And kra more college near the omunim. But now we drew on menopausal age say now we go through those dryness. That's what is being recommended say. Ebe se obekwa kutobi. A water based one. A water based one and no na mawo. But say daily basis obi ni obi twempona awarefo na mo feel those say enye monopause. But obi wo ho na oye a little bit drier. I mean, I know there a different topic I bet doing come later. But right now, there, me say mono, yes, you need it, a bit wow. But while daily basis, wa brabo mono, and we be doing come later. And see, where the basis on the patcho me that's it.
But on the time I said, so you won't have any intercourse. You don't really need to use those. That's what I'm trying to use. Say.
I said the actual mono. Monopause no the symptoms ni be those dryness. And until you recommend say with a home lifestyle no remedies are ubetimi aye with it's recommended say ebetimi aboa. Sempacho what's the question I say? What's the answer I say? Sempacho sister.
Yeah.
What's the say?
I'm at your say.
Yo.
Yeah. But from the Kakaba Candia, Sister Rita Kayan. I told me to make a hello.
Opening Pacho to me, Kasa.
Oh, okay. Uber to me so I use to A and D. Regular A and D, but A and D the end say who use every day. At least week over to me there for 2 or 3 times. So once I dry pana lubricant here there and so over to me so I use to A and D at the account. Regular A and D at least 2 to 3 times a week, with me any Vanessa Venya 9 cents.
Thank you. Pacho, Sister Mandalina, Pacho, what's our question?
The part of my next question also said true monostate age, monopause age, so sometimes so panic attack na anxiety need stress na ma pressure echo high and also so send the best me maintaining.
Okay, so for panic attack anyway, yeah, sana opening reader can say visual say a beach be a call yeah how calm it was, that is also recommended. But deep breathing, or practicing deep breathing, or practicing meditation. Those are also things you can do at home. A bit me abwa because we are calmer and oppression so be cough. And we have these soothing music. I will call YouTube crowd. Yeah, na ewo hɔ paa. Say eno na ɛboa it will also help you calm down and also ɛboa. Sɛ woyɛ obi so a wɔpɛ writing paa so a wobɛtumi anya book bi wɔ hɔnom a wobɛtumi atwerɛtwerɛ mu a boɔ no ma ebi a writing relaxes the person. Ɛboa no ma ne stress level no ɛkɔ fam. Reduce the anxiety ni wei ni nti sɛ woyɛ obi so a wopɛ writing so a wobɛtumi apɛ book na what practice writing more in your journal. And me wa.
But what they may be starting say, be an hour, now there's too many things going on. Mamma to me, Cobonium, and I thought to me, writing. Then I bet me, I bet me, I free those things. To be our word, mum. That's a win to me. When it's our chances, not tea music, nothing for now.
Yo, Sister Perpetua, opanyin patro me so ne die kasa. Sani wo kasa bi ana wo adwuma mu no. I believe say adwuma mu ye nyina ya wo your phone wo ho. And mo betimi asọ kwan bathroom breaks wo ho. Mo betimi akọ bathroom, mo betimi abu nso mi no go w'anim. Na wagina ho calm way. Ebe relax kakra. Then you come back to w'adwuma so. So phone so ɛwɔ ho na wokɔ bathroom break crowd wokɔ a wobetumi kora de ato ebi a comedy bi wotie sere kakra a afei bo nso relax kakra nti one or two things a wa wobetumi ayɛ a wo feel sɛ we me yɛ adeɛ we a ebetumi aboa me ama relax na metumi ama my anxiety akɔ fam no it's all up to you so what you say abra wo adwuma mu a we need access to so many things and apɛ sɛ woyɛ no pacho.
Yes.
Yeah, that's it. Mpamucho, why biom never question? Pacho, be man is aswana. Yeah. Yes, so if there's no more questions, yeah, better wrapping it up now. Yeah, ended this portion of the actually 1 second. Another question about chatting is to say, how about the BRCA?
Yeah, that's the BRCA gene, and then the more BRCA 1 and 2, and then they cause it those gene mutations they cause it breast CA. And see, I don't know, it's a genetic test. Opa obetimi aye. It just shows you if that means you are more prone to obetimi anya breast cancer later in life. One thing I noticed say most people are more test say more for no maybe or maybe maybe a grandparent and I say a strong family history of breast cancer. They will test maybe before worry to make sure say was a mutation or not. But that's it.
Pacho, me a question about that.
Yeah.
I think some notice is said like above a phone, some test, yeah. Sometimes, they breast tissues,
Yes.
So is that recommended?
Yes, it's recommended because on early prevention. Because the breast cancer develop here is the breast tissue that it develops from. So if only can or the maybe silicone or the ashehwa, say cancer never breast and then spread. Say cancer no breast tissue no, it's actually unlikely. And then a lot of people actually go ahead and just preventive measures. No way, no for no. Obi wo heart to say just like ovarian cancer too. Obitimi in ovaries, right? Because on per se, on per se in the future, no not and also alcohol. On per se in the future, no so no and also betimi alcohol say issue a man.
In Patrick, question about chatting. So, would you recommend everyone now on tested so when you have history of breast cancer
My recommendation will be that if you have a strong family history of it, you should test for the gene. So, because a strong family history, I mean, umame, and our umame sister, your aunt, and I say we call it first degree relative.
what sister nanya breast cancer. Those are the things we should test. But one thing I would say is that minimum say yeah Ghana for most people know these are not things that are common in our culture. Into obi woha and I say unless maybe later on they will realize that my cancer, breast cancer, little later in life. So unless we will be a strong family history, then yes, I would recommend that you should go test for it.
Okay, thank you. Mpamucho, any more questions before you wrap it up? Yo, so she knew her and you be jai wa han you be free you about Megan who know my vote of thanks before end the meeting. See. Megan, are you on the line?
Yes, I'm here.
Okay, thank you.
Good evening, everyone. What an absolutely informative session that we had today. First and foremost, I want to take a moment to express our deepest gratitude to God for bringing us together this Saturday and allowing us the opportunity to deepen our understanding of our health. A thank you to the St. Theresa executives, Opening Mary, and her wonderful team for their tireless efforts in organizing and promoting this impactful event. We are all very grateful for your leadership. A very special thank you to our extraordinary presenters, Dr. Azira, Sister Lydia, Sister Grace, Sister Alberta, Sister Mavis, Opening Salah, Opening Rita, Sister Christina, and Sister Abigail. Your insights and knowledge have undoubtedly transformed this afternoon into a learning experience that we'll all carry with us. A special thank you to our organizers and the health team, Opening Mary and Dr. Bridget, and our MC Rose who have put together such a lovely event this evening. And lastly, to all the St. Theresa members joining us today, thank you for your active engagement and participation. Your presence and contributions have made this event even more meaningful. May God bless each and every one of you richly and abundantly, and I hope we can continue to find value in and support these incredible programs together. Thank you all again, and may you all have a best and fulfilling rest of your day.
Thank you so much, Megan, for giving us the vote of thanks. It's in show baby ye be jai wahana yatwa meeting so. Thank you so much.
Yo. Yɛda mo nyinaa ase. Yɛda mo ase paa. Star Rose yɛda wo ase. Megan nso yɛda wo ase. Wo ne Mary Buadu nyinaa sɛdeɛ nnɛ mo lidi nkwalaa no. Ɛma wɔn yɛ adwuma no. Nyame nhyira mo nyinaa. Afei, Dr. Aziri ɛne Ɔpanin Sɛwa ɛne ne team. Yɛda mo ase papaapa. Ya monta mesrasra ye na de muka ye atoto ya kuma so pa da mase nyame nhyiram yo father Paul mpacho wo so a Christ asumdue enkan
enka mo nyina
father mpacho ye da wase se wase mre na watimi abetie ye Nyame onhyira wo paa yɛda wase papaapa yo pamcho yɛka se yɛbɛtoa meeting ne so a sɛ time kɔ bebree no ana ɛkɔ adwuma nti yɛbɛgyae asi ɛha no Nyame boa bosome sɛ ɛnɛ no yɛbɛtoa so nti me pamcho wo mo bia ankɔ sister Christina Mpacho.
Hello, also.
Yo, father, me Pacho, who was so dear, why father, your penny, Pacho, Bomodia, a bompire, my na, ye, father.
Oh, a bonfire, Jano, Banis is a concording. Don't put me a coupon. I say, Dana, so. Eda was if you say a fro, no. What's your income? What a boy, I'm a baby, I call ye. What my yeti, a pomodian so a semono. My young family, Jumana, Bibi, and soon call ye my. It's row, Sray so, and a dream. Omoko Juma, so she almost so. na ma bibi akɔ yie ma yɛn. Ɔmo a ɔmo boa ma dwumadie no nyinaa kɔɔ so nso no yɛda wase. Fa yɛde ɔmo nyinaa ahyɛ wo nsa. Kɔ so na dom wɔn anɛsefoɔ, dɔktafoɔ na ɔmo to ɔmo adwuma no so na yɛn nyinaa yɛnya apɔmuden ne asomdwie. Kɔ so na kyerɛ yɛn wo kwan no na yɛndi so daadaa. Na wieɛ no yɛde aseda ne animuonyam akyɛ wo din na animuonyam daa. Ɛwɔ wo dɔba Christ din mu ɛnyɛ hɔ. Onyankopɔn
Amen.
nhyira mo, ɔmbɔ mo ho ban. Ɛwɔ Gya no ne Ɔba no ne Susu Kronkron din mu. Christ asomdwie nka mo nyinaa daa.
And counsel.
Sierra Dina, open, Yedawa, Sierra Dina, Yedawasi, Yedawasi, Sierra Dina, Yedawasi, can we take it again? Yeah, yeah, that was it. Yeah, Radinya. Yeah, that was you. Yeah, see